So the patient is Annie. She's female, age 80, admitting chief complaint, dementia, stage 4, ulcer to the coccyx with necrosis and foul smelling drainage. Attending physician Dr. Boyle, consultant seen during this hospitalization, wound care nurse Donna Briggs. Her present diagnosis is infected stage 4 ulcer to the coccyx and wound debridement, ER nurse management, ER management, D5.45 normal saline, 1 liter, complete blood count. Allergies, no known allergies. She's full code. Isolation status, none. Admission height, she is 5'3". She weighs 130 pounds. She is fall risk. Communication needs, none. Past medical history, she was diagnosed with dementia in 2019. Also diagnosed in 2019, stage 4 ulcer to the coccyx. Significant orders during this hospitalization, vital signs every 8 hours, bed rest, turn every 1 to 2 hours, G-tube care, wound care, heel protectors, soft wrist restraints, every 24 hours, lab orders, complete blood count, daily AM draw, dietary orders, NPO, JEVD 1.5 feeding per G-tube at 50 milliliters an hour every 24 hours. All right. Hello, Annie. My name is Patrick. I'm going to be your student nurse today. Annie is, she is nonverbal, so she will only be able to respond in moans. But we're going to go ahead and check her wristband here and make sure she's the correct patient. Yeah, it looks like everything checks out. Annie, hello. Can you tell me your name? Okay, so yeah, as I said, she can't really respond to any of my neuro questions. All right, it's okay. So just wanted to demonstrate that she couldn't respond to my neuro questions. But yeah, what else? So yeah, so her chief admitting complaint was stage 4 ulcer to the coccyx with necrosis and foul smelling drainage. Yeah, so in order to assess if she is likely to develop another pressure ulcer, we want to use the Braden scale. So for her Braden scale, her sensory perception is very limited, rated at a 2, because she does not have any pain reception in her right leg and right arm. The moisture, she is occasionally moist, which I rated a 3, because she is incontinent and she has diarrhea. And since she's not able to move to use the bathroom, she kind of has to lay in that moisture, which is also very near to the coccyx, which is where her stage 4 ulcer is found. Yeah, and then her activity, I rated a 1 because she is bad fast. Mobility, rated a 2 because it's very limited. She has a contracture in her right leg, and as I said, she has a paralysis in her left and right leg. She does move occasionally where she can self-move. Her nutrition, I also rated a 2. It's probably inadequate because she has refused any food orally her whole hospital stay. So she has a GI tube, or a G tube. Friction and shear, she is very, well, not very, I'd say she is there's like a potential problem for shearing and friction. As long as we keep her bony prominences from hitting each other, we should be fine. She does have heel protectors on and restraints. Yes. So her Braden score is a 12 based off the information that we were provided, which is below a 16. So she is probable for having pressure ulcer formation. But yes, she could also be maybe potentially at risk if she ever goes below a 9. She could be high risk for pressure ulcers. So yeah, we're going to go ahead and assess her her chief complaint of the stage 4 ulcerative coccyx, the necrosis, and foul smelling drainage. So we're going to go ahead and take off her soft restraint so we can assess her coccyx. We're going to assist the patient to her side. So here we can see that her coccyx has a stage 4 pressure ulcer. The stage 4 pressure ulcer is deep enough that you can see the bone and muscle tissue. You want to measure the pressure ulcer. So the width we can say is 7 centimeters, and length is also 7 centimeters. You want to use centimeters to measure. Use a measuring device with centimeters. And then you want to also, you would take a cotton tip applicator, place it in the wound to measure the depth of the thing, and then you would see where the you would also be wearing gloves, but yeah, you would mark where the surface of the skin lines up with the applicator and compare it to the measuring device we have with centimeters on it. So we can say that is maybe 3 centimeters deep. So yeah, it's a stage 4 pressure ulcer. She appears to have Escher, which is black necrotic tissue right here. There is Slough, which is like a cream yellow necrotic tissue right here. There is granulation along here. And then we have a purulent drainage coming from the tissue. So that's like purulent is like a greenish yellow in color, and it's also, as we said, it is foul smelling. So the tissue around the pressure ulcer is red in color, appears warm to the touch. There's no evidence, or we don't have any information saying it's tunneling, or yeah. All right, so the patient did see a wound care nurse and does have a diagnosis for wound debridement. So there would have been a there should be a dressing over this already, but in case there isn't, and the patient maybe had removed it, we would have to clean the wound using soap and sterile water, sterile saline, and then we would pat it dry and then we would take a sterile gauze with saline, and take a cotton tip applicator to fill the wound with the saline gauze, and then we would take a dry gauze and put it over the wound, and then take an abdominal pad and put it over that and tape it over that to keep the wound clean and dry. That would be considered a wet to dry dressing. So once we check the dressing and the wound on the patient's coccyx, we can then have the patient assess the patient's back down. The patient has orders to be turned every 2 hours, so we're gonna go ahead and have the patient turned. Make sure that there isn't pressure being applied on the pressure ulcer. Put back the soft wrist restraint, and then we're going to assess the patient's G-tube. The G-tube appears to be intact. There is no redness around the insertion site. It feels warm to the touch, but it's like the patient's normal skin temperature. And then you would want to assess, if you were to have an intervention here, you can clean G-tube using saline and normal soap, and then had it dry. Make sure that the insertion had to dry. You would also ask the patient if there's any pain. Is there any pain around your G-tubes insertion site?
Mm-hmm.
No. So yes, there's no pain, there's no redness, there's no swelling. You would occasionally flush the G-tube with saline, and make sure that the G-tube is covered when there is no feeding going through it. So, and then we are going to have make sure it's also just fastened to the patient and doesn't get caught on anything. And then we're going to go ahead and go look at the IV site. The IV site here, you want to check for any swelling, redness, patency of the IV line, any drainage coming from the insertion site, or from the IV site, I mean. So the IV site is looking red in color. It's warm to the touch. Are you experiencing any pain around this area on the IV site?
Mm-hmm.
All right. So, but the patient does not have any pain perception in her right and in her right arm and her right leg. So, but we would have to. It appears to have an infection because it's red. So we're gonna have to relocate the IV site to another site. And then after we assess the IV site, we would take a look at the patient's soft wrist restraints. You want to make sure that the soft wrist restraints aren't injuring the patient. So just take a look at that. Make sure that they're comfortable enough to the point where the patient is unable to injure themselves or remove their IV line or G-tube. But just make sure that the soft restraint isn't injuring the patient. So you don't have any signs of contusion or there's no change in skin color. So yeah, this looks fine and intact. The last thing we're going to look at here is the patient's heel protectors. Well, the patient has a contracture in the right leg, so we can use range of motion to see if the patient is able to move their right leg at all. But they should not be able to if there's a contracture. So the range of motion is not available on the right leg, and the patient is paralyzed in both legs, so there really is no range of motion there. Patients would not be able to move on their own. And then they could still move though. Looks like the left arm is the only thing they would be able to move. Since would you be able to move your right arm? Since we're doing, I guess, a neuromuscular assessment here. Go ahead and squeeze. So just the left arm has strength in it. Okay, so we're going to go ahead and assess those heel protectors. You want to remove these every once in a while to make sure that the patient has no skin discoloration or swelling. You want to also make sure that the heel protector is actually elevating the foot or in the heel off the surface of the bed, away from anything that would bruise the patient or injure the patient. So there's no skin discoloration or swelling. So the patient, you also might want to check in between the toes and capillary refill at this time. So yeah, there's seems to be good. Same thing with this other foot. The heel protector is keeping the heel away from the other patient's bony prominences so they don't rub against each other. There's no contusions, no swelling or coloration. Yeah, that should be it for the assessment.